So we'll just wait for people to join. Hi, everyone. Welcome. We'll just give it a minute or two for more people to join and then we'll start. We will you're allowed to ask questions during this, so you should see where you can just put comments and we will ask those at the end of the talk, and we'll try to get through them all as best we can. But let me just introduce you to everyone and then we will start. So thank you very much for joining this free puppy parenting class. This is our first class of many that we have coming up over the next couple of weeks. And this one is Ask the Vet. And we've got multiple guests on this one. So we have Ben the vet, the TikTok star, practicing vet. We have Nicki Fox, who is part of Admiral's pet insurance team. And then John Burns, MBE, who is the founder of Burns Pet Food, which he switched from being a vet to a pet food business 30 years ago this year. So welcome, everyone. Thank you very much for taking the time to be part of this class for everyone. So there's lots of things that we are keen to cover today, especially myself as I've sat here with a puppy on my lap. So I personally am very excited for asking these questions. So first, I'd like to start with about bringing a new puppy home. And Nicki, I'd love to go to you. Sort of the first thing to know would be at what age is it safe for a puppy to come to its new home?
Sure. So the general consensus between veterinary professionals is sort of no earlier than 8 weeks, really. The reasoning behind this is that it's a critical age for the learning and development of the puppy. The puppy is learning important life skills from its litter mates and its mother. Should the puppy be taken away any earlier than 8 weeks, unfortunately, there are implications for behavioural issues as they get older. Any effective and experienced breeder will usually socialise that puppy as much as possible for you before you take them over, just exposing them and desensitising them to as many new environments and as many new people as possible.
Great. And do some breeders might choose to keep the puppy longer? Is that a good thing for the puppy?
Absolutely. I mean, ideally a few more weeks would be great. Any longer than that can also have implications as well. But I would usually say anywhere between sort of 8 and 10 weeks is normal.
Great. And what should new puppy owners be aware of when they first bring their puppy home? I'm sure you've got lots to say.
That's quite a comprehensive question, but I'll try and narrow it down as best as possible. My advice would be to prepare as much as you can and do your research. I'll try and break it down into a few bullet points, otherwise we could be here all night and I'm conscious of time. But the first thing I would say is ask your breeder as many questions as possible to make that transition as smooth as possible between homes. Ask them what food they're on, what they've been exposed to, what bed they have, what food they have. And I would have a checklist readily available for things that you need at home, such as a crate, a bed, food, toys, etc. And the PDSA on their website have an awful lot of information that you can use and have a checklist from home. So I would definitely recommend doing that. I would prepare a quiet and safe space at home for your puppy to retire to, somewhere away from sort of heavy human traffic, where they can go where they feel really tired, or if they're feeling quite overwhelmed at home as well. I would recommend taking some time off work as well, just so you can bond with your puppy, particularly if puppy's quite small as well. I would want to be at home supervising them as much as possible, and just spending some bonding time as well. I would take your puppy straight out into the garden when you bring it home, regardless of the length of journey home from the breeder, straight out into the garden. The sooner you get toilet training, the better. And also it builds up their confidence in that environment as well. A lot of breeders will give you a blanket or a toy that smells of their mother and their litter mates. That's quite important just for security and safety. It makes the puppy feel so much more at home when it has familiar smells around it. For the first few days, keep the house nice and calm. I would allow your puppy to explore, supervised, I might add, and just expect them to sleep quite a lot when they come home as well. As exciting as it is bringing a puppy into the home, I would avoid visitors for the first few days just to give them time to settle. If you do have existing animals at home, other dogs, kittens, any sort of animal, just give them time and introduce them slowly, and make sure that that is supervised as well, and never leave them alone together. And most importantly, just be patient. It's going to take time.
John, would you have anything to add to that? If you had to add one thing that you think is really important for a new puppy owner to be aware of when they bring their puppy home, what would your advice be?
I think that was pretty comprehensive, really. I don't think there's much one could add to that, really.
And Ben?
Yeah, no, I agree. Very comprehensive. I mean, I think one thing that I generally recommend is crate training. I think it's a really good thing to get your dog used to having a crate as their sort of space. You can think of it as their sort of bedroom rather than like a cage to shut them in and lock them away. You know, it's important for a dog to have some of their own space as well. So getting them used to that is a really good idea at a young age.
And then Nikki, this one's for Nikki, but I'm sure John will have good opinions on this as well. But should owners be worried if their puppy isn't eating when they first come home?
The first couple of days can be quite stressful when they're transitioning from one environment to another. I would say it's quite normal to be off their food for the first couple of days. But what I would say is if the puppy is not drinking water, if the puppy has any signs of vomiting or diarrhea, you really should seek veterinary attention sooner rather than later.
And John, any advice on how, if a puppy's not eating when it first comes, how best to try and get it to eat food?
I think if it's not eating, that probably suggests stress, and the things that have been mentioned already would have to be addressed. So making sure the puppy isn't stressed by people and noises, and etc., etc.
Great.
I think it's probably acceptable for a puppy to eat very little in those first day or two. Yeah.
Great.
But any longer than that would be a cause for concern.
Yes, great. Thank you. Please do ask questions, guys. Just add them in the comments and we'll try and ask those to our experts. I'd like to move on to vet checkups now, Ben. So I'll throw this one to you. When should new puppy owners take their puppy for its first vet checkup?
So generally, I recommend waiting a couple of days in general. So it just gives them a bit of time to settle into their new environment. Obviously, it's stressful coming away from their mother. If you then immediately take them to a vet, then that can just be an additional source of stress. So wait a couple of days. But I definitely get them checked within the first week. And any congenital health problems that they've been born with are best picked up as early as possible. From a point of view of addressing them if that's needed, but also maybe that you need to have a discussion with the breeder if there's any major problem that's been picked up with your puppy. Certainly in the first week.
Great. And how often should they visit a vet?
Regular checks are really important for puppies, and of course, just to check that they're growing properly, and to check there's no sign of any health issues, but also just to make sure that your dog is building up a positive association with the vets. The vet or nurse, often sort of monthly checks are done by a nurse for puppies up to the age of 6 months, they'll get a treat, and they'll hopefully learn to have a positive association with the vet. If every time they come into the vets they're having an injection or they're ill and they're getting a thermometer shoved up their bum, then they're just going to learn to be fearful of the vet, and that can really present problems. So we see some dogs that we just can't examine because they're that fearful of the vets. That does happen. I had a dog this week that we couldn't even get a muzzle on. Put in that time early.
Great. And when you're checking a puppy for their health checkups, what sort of health-wise are the things that you're looking for when you're checking them?
So we're checking their weight. So if they're coming in regularly when they're young, just checking that they're growing as they should be. Yeah, we generally, particularly the first time they come in, we do a full head to toe examination as we would with any animal that comes in. And particular things we're checking for with puppies are checking for any heart murmurs, hernias, any abnormalities with their teeth, making sure they don't have a cleft palate, and making sure both testicles are descended if they're male, and yeah, just checking for signs of parasites that are common, like fleas or ear mites.
Right, and we've had a question. I will throw this because we're on this subject already, but Lisa would like to know how often should pups be wormed when you bring them home?
So the general advice would be to worm them every 2 weeks until they're 12 weeks of age, and then monthly until 6 months. And then in most instances after that, it will be every 3 months.
Great. And then while we're on this subject, it'd be great to talk about vaccinations. And I guess not many people will be aware of, they might be aware of the vaccinations that they've had as a child or they've given their children, but maybe not aware what puppies are actually vaccinated against. So it'd be great if you could just talk through that a bit.
Yeah, so there are 4 different infections that are part of the kind of core vaccinations for puppies. 3 of those infections that we vaccinate them for are infections they can pick up from other dogs, and the one that people are most likely to know is parvovirus, which is a viral infection that can be fatal, and it is something we do unfortunately see, but is very much a preventable problem. And the 4th is an infection called leptospirosis, which is spread by rats and mice and rodents. And so the main risk of your dog contracting leptospirosis is from stagnant water or anywhere rodents have been.
Great. And at what age should they have their first and second vaccinations?
So generally, the puppy should have had their first vaccine by the age of 8 weeks, which is the earliest that really anyone should be taking a puppy away from their mum. And then the second vaccinations are, depending on what vaccine is used, the different brands and vaccines have different protocols, but either 10 or 12 weeks. And depending on what area you're in, if it's a high risk area for parvovirus, some vets will recommend an extra parvovirus vaccine at 16 weeks.
Great. And how, just on that, if you're in a high risk area, how can people find out about that? Is that the vets are very knowledgeable about that, I'm guessing, from the cases that you see and treat? Yeah,
I mean, I think according to the WSAVA guidelines, some international sort of guidelines, it is generally recommended to make sure there is a 16-week parvovirus vaccine given, but not all practices necessarily have that as part of their protocol. I think it's just worth discussing with your vet, so maybe worth bringing up with them if they haven't put it up with you.
Yeah. And then how often should they have their boosters?
So every year, so they need some kind of booster every year. Although after the first year, it's only the leptospirosis part that they have to have a booster for every year, and the other 3 infections is just every 3 years after that. It's just that the immunity for leptospirosis doesn't last very long, and it's also something that we can't test with titer testing. So it's not something we do very often because it's not usually very cost effective, and vaccinations are very safe products in medical treatments to use, but we can't use titer testing to really assess if an animal is immune to leptospirosis or not, so we vaccinate every year.
Could you just explain what titer testing is in case people have not heard of that?
Yeah, sorry, it's a little bit jargony, but titer testing means that we're measuring immunity by we take a blood test and we measure antibodies in the blood and to see if they are immune, have immunity to an infection. Great.
And are there any possible side effects, like things that when puppies go home after the vaccines that puppy owners should be aware of? They need to go back immediately.
So it's quite normal that they, I should say, in most instances, you probably won't notice any side effects. But it is common that they might be a little bit subdued or quiet for 2 or 3 days after the vaccination, after we have a flu vaccine, for example, you might feel a bit achy or have a mild fever, so the same for them. And it's not uncommon they can develop a small lump at the site that they've been vaccinated at between the shoulder blades, and that will generally go away within a few weeks. One common kind of area of misinformation is related to some of the vaccinations, and particularly one of the vaccinations called L4, which is one of the leptospirosis vaccines, and it's something that I do hear people say they've heard quite commonly from their breeder, that it's a dangerous vaccine, but actually it's extremely rare that there's any adverse reaction to the L4 vaccine. I've vaccinated animals with L4 for the whole of my career for 8 years and never seen any serious adverse reaction. So there's no real significant difference in reactions between the two. There's a different type of lepto vaccine called L2 as well.
Yeah, I think that's great to hear, because it can be quite scaremongering sometimes for people, because there's a lot of comments and opinions online.
Yeah.
So I think it's always good to hear from a vet who, especially one who's not treating your dog. So it's a, third party advice.
Yeah.
And then neutering, and I will come to Nikki and John on this as well. But I think I know from talking to people a lot about when to spay a female dog, sort of after her season. Like, can it be straight away, or what's the recommendation on the best practice to do that?
So we generally, the timing can be either before the first season or you have to wait. Generally, the general advice would be to wait around 3 months after the season. There's a higher risk if they're spayed straight after their season of bleeding during the surgery. And also, we can't neuter them too soon after the season, because dogs undergo, the way their hormones work, that they undergo a lot of the same hormonal changes as if they're pregnant. And it's quite common that dogs can have a false pregnancy. We spay them whilst they're having a false pregnancy. One of the most common signs of that is that they produce milk. Then they can develop problems where they keep producing milk after they've been spayed, or there's some evidence that they can develop some behavioural problems as well. A few things to bear in mind.
Great. And are there different procedures, so sort of different options in terms of the way that they can be spayed or neutered?
So I mean, not really for male dogs. There's only really one way of castrating them, but for female dogs, there is the option of them having keyhole surgery. It is a more costly procedure, but they have a smaller incision and potentially a shorter recovery period with that.
And how long is the recovery period normally after spaying and neutering?
Yeah, I mean, I don't know about what you guys think, but I find that generally the issue can be that they feel well a bit too soon after the surgery. And though we say the recovery is 10 to 14 days, it's often seems to be more quick than that. I don't know about you two, what you think.
I think it depends really on the individual and the size of the dog. You will have some small breeds that will bounce back quickly and want to jump on and off the sofa and, feel full of life straight afterwards. But it's really important to remember that they've had surgery. I'm a huge advocate for laparoscopic spaying as well. The recovery is a lot shorter and surgery is a lot less invasive. So they tend to bounce back from laparoscopic spaying much quicker. But yeah, it is really specific to the animal, I'm afraid. But if we can try and keep them as calm as possible, that's key.
Great. And John, did you have anything to add on that?
Well, it's a long time since I spayed or castrated a dog, but it used to amaze me how quickly a bitch would recover and be running around. Sometimes just immediately after the operation, and you think, I can't imagine a woman with having a hysterectomy would be like that. So
they're very resilient dogs, aren't they? And then, John, while we've got you, it'd be really interesting to talk about sort of basic nutrition for a puppy. So does what your puppy or dog eat have an impact on their overall health?
Well, there's a question to ask. Of course it does. Same with humans. I may be a bit off the scale here when I consider the effect of nutrition on health, but that's really why that's my speciality, I suppose, and why I went into pet nutrition, using food as a way of managing health, preventing health problems, treating pre-existing health problems. So the answer to that is a very big yes.
Great. And this this is not me asking for feeding my dogs, but is it okay to give dogs human food?
Well, it depends a lot on what the human food is, and it also depends a lot on the dog's health and well-being. A health can be given a little bit of human problem with that at all. Before I started with my pet food business, I used to recommend home-cooked brown rice, vegetables, and meat in equal proportions as a way of treating pre-existing health problems. So human food can be quite beneficial, but it's important if you're trying to deal with a pre-existing health problem. One has to be much more careful about what you do. In general, vegetables and whole grains like rice, for example, these are pretty okay things to give, but you have to be more careful when it comes in fat. I think these could potentially.
Oh, we lost you a bit there, John, but I think we understood what you were saying. And what should a puppy owner do if their puppy has eaten something that is toxic to them, like such as chocolate? Obviously, we all aim to, keep eyes on them at all times, but sometimes they grab something without looking. What's the advice? What should people be looking out for? Should they go to the vet straight away, or do they need to sort of monitor them and look for certain reaction to what they've had?
Well, as with many things, one could be ultra careful here and suggest going straight to the vet straight away. I sometimes wonder about how much chocolate is actually in chocolate. Some cheaper chocolates probably don't have much cocoa in them anyway. But generally, I would expect to monitor the dog for a time to see if there's any sign of ill effects. A lot depends on what it is they've eaten and the quantity, I think. I think the others may have some views on that too, though. Yeah.
Ben, any thoughts?
Yeah, I think, definitely the general advice would be to, I guess at least call the vets just for, just to sort of double check. And then maybe they say, oh, don't worry. Things like chocolate, small amount of milk chocolate for a large dog. If they eat a square of dairy milk, then that's not likely to cause any major problems. But larger amounts of chocolate, dark chocolate, in even small quantities can be more toxic. If you have a small dog that's eaten even a relatively small amount of chocolate, that's more likely to cause problems. So it's worth speaking to your vet. There are various sort of dosing charts that they can consult to just check whether the amount of chocolate that your dog has eaten is enough that we need to see them and make them vomit it. And sometimes other treatments like charcoal are given, or if it's only a very small amount, then they may say not to worry, but speak to your vet.
Great. And John, back to you. Treats. They're obviously a great way to train dogs, but how often should we be giving our dogs treats? And do we need to adjust their meals accordingly if we're giving them treats on top?
Well, I think pet owners get a lot of satisfaction out of giving treats, but personally, having kept dogs in a large part of my adult life, I never use treats very much. The best treat I think you can give a dog is by congratulations and saying kind words. Or if you have a health problem or have an overweight dog, I often recommend the best treat you can give is to take the dog for a walk rather than giving them food. So, treats should be that, in my opinion, something to be given occasionally, not something to be given frequently or and in large amounts.
Great. And then this is a question I love to throw to all of you, and I'm going to start with Nikki. Sorry, one of my dogs wants to be on camera. What are the common reasons or issues that you see puppies coming in to your clinic?
So in some of the clinics that I work for locally, and in most practices, they offer vet nurse clinics. And I would say for puppies, it is for socialization. It's so important. So puppies would come to me on a regular basis, at least once a month, so we can weigh them, make sure they're growing and developing properly. Also, just to desensitize them when they're in the clinic. So being able to handle them, hold them in certain positions. I can demonstrate here on Eddie, if you can see him, but just even simple restraint, being able to touch their head, their ears, feel around their mouth, their body, their tail, their paws. It's so important to just show them that there's nothing to be afraid of. So every time they come into the clinic, they're not always going to get an injection, or like Ben says, a thermometer up the bottom, and to introduce them and show them around the clinic, because at some point that dog is likely to come in for neutering or something a little bit more complicated. So I think it's quite nice for them to come in. So I would say the most regular puppy checks they come in for is flea and worm treatment every month, and just general development checks.
Great. And Ben, what about you? I guess, and in particular, it would be good to know any sort of specific like health problems or conditions that you see them coming in for.
Well, I think the most common things we see puppies for in terms of health issues would be diarrhea and vomiting, particularly. Most commonly we'll see diarrhea in the first few weeks. It can be most common reasons that puppies will develop diarrhea will be either because of dietary problems, because their food's been changed too frequently and they've been given too many treats, or they're eating horrible things off the floor, or that they're carrying some kind of infection or parasite, and that's more likely if they come from not the best breeder and perhaps aren't kept in the best conditions, that are overcrowded, and there's a parasite called Giardia that's particularly common, and unfortunately we do see a lot of puppies carrying that and needing treatment for that parasite.
Can I add?
Yes, yeah, John, I'd be interested to know from when you were practicing.
Yeah, well, I'll just add to what Ben has said. I think overfeeding can cause diarrhea or loose stools. So it's most important. Everybody likes to feed their puppies, but overdoing it can cause diarrhea. That's usually the first sign of that.
Yeah.
And I know you touched on as well, Ben, about changing their food regularly, and I think that's probably a common thing, isn't it? If my puppy's not eating, maybe they don't like this food, so I'll change it. So I know we have a class on nutrition, John, but I'd be interested to know your advice on that. Would you recommend to not keep changing their food and just sort of stick with it, and they will eventually start to enjoy that food, or if they are getting an upset tummy from that food, at what point should you decide that it is time to change?
Well, it can be difficult to assess exactly what's going on. As I just mentioned, overfeeding could be the problem. It may call for a change, either just simply a reduction in the amount of food might be the answer, or it may be a change of food. Any change in diet in the dog should be done over at least 5 days. That's the length of time it takes for the digestive enzymes to adapt to a different food. So it's not something that should be done repeatedly.
Yeah. Okay, great. Those are all my questions, and we've got a few questions, so I'm going to throw them to you all. So this one is from Rebecca, and she said her pup seems to be biting his tails and legs a lot. She's put that down to teething, but could it be something else? Ben, would you like to answer that one?
Yeah, absolutely. Yeah, it's unlikely. If it's specific areas of the body, then it's less likely to be due to teething. So it may be that the puppy has fleas, less likely to be like a problem with their anal glands or some other skin problem. So I'd say, yeah, definitely worth getting a vet to check that if you're concerned. Obviously check for any sore areas of skin or anything obvious. And one thing you can do is to check for fleas, for signs of fleas on your dog. You get a bit of white paper and wet it and brush your dog's coat over the wet paper. If they have fleas, generally we'll find flea dirt, which is flea poo. Basically, it's digested blood, and you'll see on the wet paper little rusty areas. So that's a good way to check for fleas at home. But if you're worried, get a vet to check your pup.
That's a good tip.
Can
Dark-haired dog.
can I add to that?
Can indeed, John.
In my experience, when a puppy is chewing itself, biting its feet, for example, it's usually because they're itchy, and that points often to a dietary problem. I had one today, in fact, speaking to somebody who the dog's chewing its feet, and it's overfeeding can do that. Potentially, it could be a food intolerance. It's something that the puppy doesn't suit the dog's system. So nutrition can be a factor there, I think.
Great. And then Nikki, there is one here from, I think it's Ursa. Sorry if I'm pronouncing that wrong. How long should you crate a puppy for? Theirs is 6 months old.
In terms of periods throughout the day, or just in life in general? If you're
I think they're talking life in general, but perhaps let's answer that as 2 points.
I can try and answer both. So I would crate train your puppy as early as possible. I know we have a behavioural seminar coming up, so I definitely recommend you going onto that to speak to the animal behaviourist to ask more details about it. But in my experience, and I've got 6 dogs, I would crate train as early as possible, just so they can get used to it. Not only is it for their safety within the home environment, but it's also a place of safety for your pet as well. My dogs love their crates. They have their own toys and beds in there, and it's a great comfort space for them. Mine is still crated now. My eldest is 12 years old. She loves to go up to bed and have her own space. And my recommendation is just to keep it up and to start it as soon as possible.
Great. And then, John, there is a question for you from Lizzie. She has a 10-year-old toy dog and said it is permanently looking for food. Should she worry?
Well, I think I'm like that too. I'm always looking for something to eat. It doesn't mean I need it, though. So it's a difficult thing to balance that, isn't it? Puppy or a dog, sorry, continually looking for food. You have to, if there are any health issues, then it's most important that the dog doesn't get that extra food, I feel. And in fact, getting into this demand for food can actually create health problems. Is it something to worry about? No, it's something to just have to live with it in general. I don't know if there's an answer.
Don't give in to
some dogs you just can't feed. You just somehow seem to be always on the lookout for food. I think owners can encourage that inadvertently by responding to the demand for food or having the dog around when there's food in view or being prepared and so on. I'm not a behaviourist really, but I would suggest that keeping the dog out of the way when there's food around may help a bit, but it's not something I would think you can worry about. It's something you have to live with.
Great, thank you, John. And then Ben, you could perhaps ask this one from Megan. How much can I socialise my puppy whilst they wait for their second jab?
So that is a bit of a difficult one, because that time period that this dogs have this socialization window, which is a really important period for their brain development, and it's between about 4 and sort of 12 to 14 weeks, and a lot of that lies in that period when they've not had the sort of full protection from their vaccinations. So I'd say it is still important to socialize them. If you've got friends or family that have a dog who's fully vaccinated, it's a fairly low risk thing for you to just socialize them with a small number of fully vaccinated dogs until they're fully protected from their vaccines. So I would suggest doing that. And you can still, socialization also means exposing them to other people and children and different sounds in the world, traffic noise, things like that. So you can still take them out and maybe carry them just to expose them to those kind of things. So don't walk them on the pavement, but still expose them to the outside world, as it were.
Great. Nikki, did you have anything to add to that?
No, that's pretty straightforward. The first vaccination gives a certain element of immunisation for the puppy. So like Ben's rightly said, as long as you are completely sure the dog you're socialising with is fully vaccinated, the risks are relatively low. And I'd always recommend doing it in your home environment as well, and in your garden. I think that's the safest way forward.
Great. And what about other socialisation, like taking them on public transport? Like, I guess if they're small enough to go in a carry bag, or the sort of getting them used to those sort of sounds, is that safe to do before the second vaccine?
I would be cautious if it was me personally, because you don't know what you're exposing your puppy to. Like Ben said, you can take them out as long as they're safe. They need to experience different scenarios, different textures, different noises, different smells. It's really important. But I would just be very conscious about taking them to places where other dogs are, where they're not potentially vaccinated.
Noted. And then Jodie's got a question for me, but I really don't think I am an expert to answer this one. So I'm going to throw this one to John. Jodie has a Pomeranian who is not pooing regularly every 3 days. She's eating fine, but not pooping. What can she do to help her?
Well, this is a bit unusual, isn't it? It doesn't sound as if there's anything abnormal there. She hasn't mentioned anything. Maybe that's just normal for her. I can't think of any. What do you need to do about that, if anything? Maybe add some vegetables to the diet to increase the bulk. Is that a good thing? Not necessarily. So I don't think it's anything to worry about particularly.
Right. Anything to add to that, Ben?
No, not really. I think it's not necessarily a concern. I guess if it's a change in their habits and they've always pooed daily and then suddenly they're only going every 3 days, and obviously if they're showing signs of like straining to go to the toilet and things like that, obviously get them checked. But I wouldn't necessarily say that pooing every 3 days, if everything else is normal, doesn't necessarily indicate a problem.
Yeah, that's quite a nice feature of a dog, I'd say.
Yeah, absolutely, isn't it?
I wish mine were like that.
It'd be good if they were all like that, wouldn't it?
Yes, it would. Well, if anyone's got any other questions, please throw them to us now. Otherwise, that is the end of this class. Ben will be back for another Ask the Vet. So if you've only just joined at the end and you missed some of the topics, you'll be able to join him again. And then we've got some other classes coming up on nutrition, behaviours we talked about. We've also got Lioness Bethany England, who's a dog owner, who's going to share her stories as a dog owner and what she wished she knew before she got a dog. And hopefully we might be adding a new class as well around rescue dogs as well, because not everyone gets a puppy, but some people do love to find a new home for a dog in need. So thank you everyone who has joined this live, and if you have any questions, please message on Burns or Admiral's social media accounts. So thank you everyone. Bye.
Thanks very much.
Thank you.